Imagine a technology capable of slashing urban poverty, cutting global emissions, and preventing heart disease. Best of all, operating it costs almost nothing. This machinery has been in active use for 2 centuries. We know it as the bicycle. Society often frames these machines as recreational gear, yet for modern urban living, they function as highly practical solutions for mobility and public health. The World Health Organization points out that people can reach their recommended daily physical activity targets through the simple, moderate exertion of a bike ride. This chart shows consistent cycling lowers the likelihood of heart disease, strokes, and certain cancers. These prevention returns significantly outweigh the statistical harm of traffic accidents, tipping the scale in favor of daily riding. For many, the act of pedaling is the most accessible way to integrate these preventative health benefits into a daily commute or routine. When we zoom out from the individual to the community, the bicycle becomes a tool for health equity, the principle that everyone should have a fair opportunity to reach their highest level of health. For the poorest residents in urban centers, owning a private vehicle is often impossible due to the high costs of fuel, insurance, and maintenance. 2 wheels provide a reliable transit lifeline. In developing regions, this translates directly to access to education, healthcare, and essential social services. Urban planners can address systemic inequality by investing in this infrastructure. Building dedicated lanes and safe walking paths gives marginalized populations secure, low-cost passage through their own cities. Improved active transport is a cost-effective equalizer that provides mobility to those who need it most. Zoom out to the metropolitan scale, and a different crisis emerges. Cities are absorbing massive population booms, resulting in dense gridlock and deteriorating air quality. This graph illustrates the core challenge for modern municipal planners. They must find a way to decouple population growth from rising emissions and traffic congestion. The COVID-19 pandemic accelerated this shift. With standard transit routines interrupted, major cities were forced to rethink how millions of people move without relying entirely on private cars. The solution involves integration. By designing public transit networks to accommodate bicycles, using dedicated storage areas on trains, cities can move large volumes of people cleanly and efficiently. Accommodating the cyclist has become a mandatory strategy for the survival and functionality of the modern, growing city. At the planetary scale, those localized drops in city exhaust contribute directly to the global fight against climate change. The United Nations identifies sustainable, clean transport as a critical component for achieving their Sustainable Development Goals, the targets set to protect the environment and improve human life. Geopolitical recognition arrived on March 15, 2022. The UN General Assembly adopted a formal resolution to integrate bicycling into global public transportation systems. This resolution links the bicycle to broader social goals. The UN views this mode of transport as a tool that fosters mutual understanding, promotes social inclusion, and builds a culture of peace. To honor the longevity and versatility of this machine, the General Assembly officially declared June 3rd as World Bicycle Day. The UN encourages participation in national and local rides. These events are designed to strengthen individual well-being and build a visible culture of cycling in society. Choosing to power a simple, affordable machine with your own 2 legs is a direct, measurable step toward personal health and global transformation.